Today, I'm going to tell you how low back pain absolutely wrecks your body, and that the longer you live with it, the more it really does destroy your body. And it's not because of the reasons that you might be thinking, right? It's not because, oh, I've got bad posture. Oh, I've got bad alignment. Oh, my spine is degenerating. It's not because of, oh, my MRI is going to get worse. I'm going to have a disc herniation. It's not because of the reasons you're thinking. Ultimately, it's not because of damage. Okay, so low back pain absolutely wrecks your body, but it's not because you're being damaged by the pain, not because pain equals damage. I'll get to that in a second. So low back pain, in this video, I want to tell you how low back pain and sciatica, the longer you live with it, will lead to essentially your body just falling apart, and how to stop it, how to stop that from happening, right? But when I say falling apart, it's not the reasons that you're thinking. Again, not posture, not alignment, not joint degeneration, not that kind of stuff. We'll talk about why you failed to fix your chronic pain in the past, why the treatments that you've tried in the past haven't been successful and have actually contributed to your body falling apart and getting wrecked by this chronic pain, and ultimately will lead to how do you escape that brutal cycle and escape chronic pain and reclaim the active life that you deserve to be living. So let's start off with why the treatment you've tried in the past has not done the trick. You've probably tried all kinds of things: chiropractors, physical therapists, massage, acupuncture, dry needling, cupping, scraping, you name it, trigger point massage, all kinds of things, and they haven't really worked. And maybe you've gone beyond that realm and you've taken medications, you've had injections, you've had corticosteroid injections, and maybe those things have given you temporary pain relief, but that's probably about it. Most of the people that I talk to who have had corticosteroid injections actually feel much worse in the few days after the injection. And if they do get pain relief, it's short-lived, unfortunately. So why the treatment you've tried has not worked? Well, let's get into it. Here's a timeline of what happens. So this is your health and function over time. We want it to be really high, obviously, and as time goes on. So what happens in real time is that, okay, here you are, normal, and then all of a sudden something happens. Okay, something happens in your life. Let's say it's an injury, although sometimes I talk to a lot of people, I work with a lot of people with low back pain and sciatica, and they don't always know what happened. There wasn't always a clear mechanism of injury. So regardless of what happened, there's basically a before I had pain and an after I had pain. And so once that onset of low back pain and or sciatica happens, all of a sudden your health and function plummets. Now you're not able to do much at all because you're in so much pain. So like a good, a person who takes care of themselves, because you're the kind of person, you wouldn't be watching this video if you weren't the type of person who wants to take care of themselves. And I love that. But unfortunately, the things that are available to you kind of suck. Unfortunately, most of them. So you go to do some treatment, or you go to chiropractor, physical therapy, you take some medications, maybe injections, whatever. And let's just say it's a chiropractor or a massage or like physical therapy. All right. Well, they do something hands-on. They massage you, do scraping, cupping, dry needling, crack your back, whatever. Okay. You feel better for a short time because you went to treatment. So your health and function improves. Fantastic. But this is, your first treatment. Okay. Now in between sessions, how do you feel? Well, that pain relief wears off fairly quickly. And now you're back to square one and you're not feeling as healthy or functional anymore, right? You're back to the same pain you were dealing with. Okay, so you go back to treatment. You go get your back cracked again. You go get some more dry needling, cupping, massage, whatever the case may be. Cool, you feel good again. Finally, relief, sweet relief. But unfortunately, every time between treatment, you're not doing anything on your own at home to make it feel better because your physical therapist or chiropractor has not empowered you and taught you how to actually take care of yourself. And so between treatment, you feel basically the same way you felt without treatment. So you have to keep coming back, right? And ultimately, after a while of this, you just feel like, I've done everything. I've tried everything. I went to the chiropractor. I went to the physical therapist. I had massage. I got dry needling. I went to acupuncture. I tried meditation. I tried Reiki. I tried energy healing. I tried everything under the sun, and it keeps just giving me temporary relief. ultimately, that can make you feel really, really frustrated and feel like just, okay, I'm giving up. I'm throwing in the towel because I've tried everything, right? And it's frustrating because you just have to keep coming back forever. You're on this rehab roller coaster, right? You're up, you're down, you're left, you're right, you're forward, you're backward. You don't have any control over the ride. And that is really a frustrating place to be. So, the big picture is, why is this a roller coaster? Why is treatment such a roller coaster? Mainly because it's temporary. It's temporary hands-on treatment of any kind. It doesn't matter what it is. If it's massage, dry needling, acupuncture, cupping, scraping, getting your back cracked, going to the chiropractor, whatever. It's all temporary pain relief. Now, temporary pain relief has a place in rehab, okay? Temporary pain relief is not a bad thing, but it is a temporary thing, right? So a good rehab, I think that we do need some temporary pain relief. We want to show, like, I want to empower my patients to, feel better, right? And then use that window of opportunity to implement a long-term strategy of exercise, education, stress relief, that type of thing. So yes, in my clinic with my in-person patients, yes, I do hands-on stuff, but the truth is it's a temporary pain modifier so that we can get you to do the long-term solution, which again is education, exercise, eating better food, right? Stress relief, that type of stuff. So this is why the treatment that you've tried in the past hasn't worked, because all of it is temporary pain relief. And at best, it's temporary pain relief. At worst, it actually leads to this process of absolutely wrecking your body. And let me tell you how, right? So meanwhile, while you're going to the chiropractor, acupuncturist, whatever, getting a massage, meanwhile, what are you doing at home? What kind of exercise are you doing? Oh, that's right. You're not doing exercise because it hurts, right? It hurts. Otherwise, you wouldn't be going to your chiropractor or physical therapist or massage therapist or whatever. So meanwhile, while you're taking it easy, while you're resting, and it seems logical to rest and recover and say, oh, I'm just going to let my body kind of heal up and then eventually I'll get back at it. But unfortunately, what actually happens is you've got this ticking time bomb, and this ticking time bomb is going to wreck your body in the future. So what is that ticking time bomb? I'm right about to explain. And how do we diffuse it so that we don't have low back pain lead to major physical consequences down the road? So the ticking time bomb is the cycle of deconditioning. And this cycle is a vicious cycle. So let me explain. Now, you start off, okay, so there's some type of injury or pain happens. Now, I'm going to take an example. This is just an example of pain that happens with bending or lifting. Okay, so you're picking up something heavy. Maybe you bend over to pick it up. You're moving a couch. You're moving a TV. You're moving a bed, whatever. Okay, so it happens with bending or lifting. This is just an example. There's a million ways this can happen, but let's just say that it happened with bending and lifting. Now, you're smart. You're a smart person. So you say, well, okay, I hurt myself while I was bending or lifting, and now I've got really bad low back pain and possibly sciatica, shooting pain down the back of the leg. So you think, okay, well, duh, I'm going to avoid bending or lifting. Okay, that seems logical, but let's see where this goes. And I'm telling you, it doesn't go to a good place. So you avoid bending or lifting. All right, so your spine isn't moving. The muscles of your spine aren't working, right? Well, what happens then? Well, now those muscles and ligaments and joints and tissues and cartilage and even the discs themselves get weak from disuse. That's right. The less you use your spine, the weaker it gets. So, okay, so now your muscles, your ligaments, your tendons, your joints, your cartilage, your discs, right? All of that stuff gets weaker when you rest. Okay, now where does that lead? Well, now it's weak, and now you're weaker than you were before the pain happened. So now activities that used to be easy, like bending over and tying your shoe, or, picking up a pencil off of the floor, or picking up a garden hose off of the ground, suddenly those formerly easy, activities are now very hard because you've become so weak from resting. Well, now that you're weak, you go to do something simple and we're back to square one. You have a new injury to your back from bending or lifting. just like you did the first time, but this time with an even easier activity. That is frustrating. But the cycle, instead of just continuing, it gets worse, right? Because what really happens is now that you have another bending or lifting injury or flare up of pain, now the brain becomes very fearful of re-injury, and it wants to do everything possible to protect you so that you don't hurt yourself again. Again, your brain, it's trying to do the best it can, but it's operating off of this lizard brain thing, this deep-rooted protective fear that's, so deep in our brain, in our unconscious, that we can't even manage it consciously. So this thing, okay, what happens? Well, that's your fight, flight, or freeze. And in your case, freeze is the answer, right? Response, that's your sympathetic response. That's your autonomic nervous system, which is automatic, which is involuntary. It's the part of your nervous system that just tries to protect you. It's your stress response. It's your stress response. And so the fight or flight or freeze happens, and your muscles freeze up and start to overprotect your back. And as they overprotect your back, well, what happens? Oh, wait, stress is not in your head. Stress is in your body. Stress leads to your body having a physical reaction and tightening up and becoming overprotective. Well, what does that lead to? Well, pain, right, is what it leads to. But also it leads to, well, how? Why? It leads to pain because it's a preemptive pain alarm system. All pain is an alarm system. That's all pain is. And so your brain, because now you've hurt yourself twice while bending or lifting, becomes very fearful, activates the stress system, which tightens up your muscles and leads to excessive pain because of deoxygenation. And your muscles are just working all the goddamn time to hold on and brace for dear life. And you've never bent and twisted, and so your spine is weak. Now the pain alarm system activates because it perceives a threat. Key word is perceives a threat, right? There is not an actual threat in bending. That's right. Bending your spine, forward, backward, sideways, twisting, all of that stuff is totally safe for low back pain, even if you have a disc herniation, even if you have a disc protrusion, even if you have all kinds of things that I see on my patients' MRIs all the time. Now, the key is not doing too much of it, but easing your way into it. So because your body perceives a threat, it activates the alarm system, and now it hits the injury button, the quote unquote injury button, which your body doesn't know the difference between a false alarm and a real alarm. So either way, it's the same to the body, which is pain. And then around and around and around and around you go over and over and over because you're resting and getting weaker and getting afraid. So you need to address the rest and you need to address the fear in order to break the cycle. So how the hell do we break the cycle? Because you cannot continue to just get wrapped up in this whirlwind because it is a downward spiral. Well, introducing the rule of twos. And this is that if you do too much too fast after doing too little for too long, you're going to get hurt. I'll explain that again, because you need to hear this a million times. This is the hardest part of rehab. It sounds simple, but it's really hard to implement. This is what I spend most of my time with my clients working on, is finding the Goldilocks zone. So here's the deal. You've got two options. You have pain, and you're going to fall into one of two categories. And most people will be in one camp for a little while, and then they'll switch to the other camp, and then they're back to the first camp, and I'll explain. So if you have pain, there's two ways of coping with it. You do too little, you baby it, you take it easy, you rest, you avoid pain. Well, you do that for too long, and now your body gets weak, right? And as a result of being weak, it's easier to injure yourself. Okay, the other way of coping with pain is you say, screw it, I'm going to push through the pain, I'm going to ignore the pain, and so you do too much too fast, which means you get re-injured because you're ignoring the pain completely, which is also a bad idea. So let's look at how this plays out in real time. In real time, your activity levels, right? How much activity you are capable of doing over a period of time happens like this. Okay, so initial injury, you get hurt, something happens, and all of a sudden you can't do very much activity. Now, the first couple of days are usually the worst. Then you kind of bounce back, but you're still not even close to where you were before the injury or before the pain came on. So now this period of kind of up and down, you go do some treatment, that type of stuff, you take it easy with activity. This too little for too long period comes on, where your body gets weak. Now, after doing this for a long enough time, if you're the kind of person that wants to live an active lifestyle, eventually you're going to get really frustrated with doing too little for too long. You're going to say, fuck this. Everything I try doesn't work anyway, so I'm just going to go live my life. I'm going to go running. I'm going to go biking. I'm going to go do martial arts. I'm going to go climbing. I'm going to go whatever, do yoga. Well, you jump back in too fast because you're frustrated, because you've taken so much time to not do anything that you just say, fuck it, I'm going to go live my life. Well, now you did too much too fast after doing too little for too long, and your body has become much weaker. So naturally you get re-injured, and now you're worse off than you were when you started. Worse off because the body is more sensitive than it was when it started, and worse off because now your brain is even more afraid of exercising. So now you're going to go back to another too little for too long phase, and you're going to do that for even longer, and it's just going to get worse and worse and worse. You have to break this cycle. This is why good rehab looks like this. Yes, you have an initial injury, it sucks. Your activity levels go way down. Then what we do is we just test the waters a little bit. Okay, then we wait. We wait a little bit. We do not increase the amount of activity you're doing. And then you go from A to B to C to D to E to F, right? We go exactly one step at a time, and we are extremely patient with the process. And then you have slow and steady progress. The problem is most people are very impatient, and this process might take 3 months, 6 months. Shit, it could take a year, especially with sciatica and a disc herniation. It could take a year to go through this process. Most people are looking at this and saying, oh, okay, cool. Week 1, week 2, week 3, week 4. No. This is more like, weeks 1 through 3, weeks, 4 through 6, maybe month 3, month 4. It depends on your individual injury. But the point is, this timeline is longer than most people want it to be. So you're impatient. So what actually happens, this is what you actually end up doing, is because you don't know the alphabet. You don't know the order to do things. And you're impatient, and that's okay, but everybody's impatient. But this is just what happens, right? You get your initial injury, you can't do much. You try to jump in about halfway, and you're skipping steps. That's a little too much too fast, so it sets you back a little bit. Then you say, you know what, this is ridiculous. I'm going to be fine. You just go back to normal activity. Whoa, you skipped a bunch of steps. Now all of a sudden you're way back in the hole. Maybe you're worse off than when you started, right? I talk to a lot of people. I work with a lot of people with low back pain and sciatica. And a lot of times what happens is the initial injury wasn't actually that bad, but then they didn't actually they skipped steps, right? They skipped a bunch of steps, and then they had to move to a new house the next week, or they had to move a couch the next week. And that's this F here, where they say, screw it, I can move the couch. It's just a couch. And then, oh my God, now they're laid out for days. Maybe they're going to the emergency room. So you're just all over the freaking place because you don't know the alphabet. And this is how low back pain and sciatica absolutely can wreck your body, is that you're just up and down and up and down, and it gets worse and worse and worse because you don't know the order of operations. So because you don't know the alphabet, you just keep getting re-injured. It sucks. And you're in and out of physical therapy. You're in and out of chiropractors' offices or massage therapy. You're just in and out of this because you keep pissing it off because you don't know the right order of things to do, and you don't know the alphabet, and you're impatient. Okay. So you can feel like, oh my God, I've tried everything, but it's in the wrong order, right? If we go back here, this can make it feel like I've tried everything. There's nothing that's going to work for me. Nothing's going to work for me, right? Because here it looks like you've tried everything. You've tried D and C and F and A and B and E and A again. You've tried all of these things. It looks like you've tried everything. And even if that was the case, even if you have tried everything, you may have tried everything, but totally in the wrong order. right? The order is way more important than the actual things that you're trying. It's not about fancy exercises. It's about doing the fundamental exercises in the right order and in the right amount and not skipping steps. So even if you feel like you've tried everything, you're probably doing it in the right or in the wrong order. And the fact is, like when it comes down to it, most people just really suck at moderation. Right? Because I mean, here's the deal. You get hurt, you're afraid, you're fearful. Therefore, what do? You baby it. You take it easy. Whoa, whoa, whoa. I don't want to hurt it. I don't want to hurt it. Okay. Well, that's extreme. That's an extreme position to take. You shouldn't just totally avoid exercise, right? We want to slowly ease our way in. But then the other way that people suck at moderation is that they say, I'm fine, and then they push through pain that they should not be pushing through. And the truth is, there is such a thing as safe pain, and there's such a thing as unsafe pain, and you need to know the difference so that you don't do too little for too long or do too much too fast. And that's the truth, is without somebody to hold you accountable, without somebody to say, whoa, that's too much, or hey, you're kind of babying it, let's push a little bit. Without that outside observation, you are left to your own devices. You're left up with your emotions. And man, I know, because I dealt with chronic pain for about 5 years. Really, those were the bulk of it, but I still had it on and off for about 10 years. And I know it's frustrating, and it gets to you emotionally. It gets to you mentally, right? I had panic attacks. I thought I was going to die because of panic attacks because of my chronic pain. And so I get how frustrating and emotional it is. And if you're in this emotional fear state, you're not making clear-headed decisions. So this is why it's so important to have an outside observer say, whoa, that's too little, let's push it. Or, whoa, that's too much, let's take it easy. So what you really need is someone to teach you the alphabet, right? You don't know the alphabet. So of course you're doing things in the wrong order. Of course you're doing too little or too much. Of course you keep getting re-injured. Of course nothing has worked. You don't know the freaking alphabet. You don't know that, this is an obvious example, but you don't know that walking is easier than squatting and squatting is easier than deadlifting, right? Duh. Well, that seems obvious, but when we get down to the ground level of like, what do you do today? And then what do you do tomorrow? Then it gets really messy and you don't know the right order. But if you do the right thing in the right amount, in the right order right now, then you get to this point of freedom where you can do whatever you want. You can really reclaim the active life that you deserve to be living. And this is exactly the process that I go through with my clients and how people like David are able to get back to an active life. So David was a golfer and he would, just try to push through the pain. He was in his late 40s. And he would go and, golf and just kind of push through the pain and, it flares it up. And he would just kind of deal with it, right? And it would just kind of lay him out once in a while when he did too much. And then over the winter, he'd completely rest and he didn't do really any physical activity, not much of note, right? So he's pretty much sedentary throughout the winter. And then the spring comes around and he goes and tries to hit the golf course again and play 18 holes immediately, right? He's just kind of a classic stubborn, middle-aged man that wants to play his golf and pushes through the pain. And it's like, that's okay, but you're just pissing it off and you're not doing the right things in the right order. So when we scaled it back and we worked from A to B to C to D, then we eventually got to the point where it's like, now we can play 18 holes, no problem. But we had to work up to it slowly, right? That's the key. So if you want to know how David did that, then I do have a masterclass for low back pain and sciatica. It teaches you everything you need to know to conquer chronic low back pain and sciatica without drugs or surgery. I have the link in the description. Please go watch that. It might totally transform your life. Teach you all the myths about low back pain, because there are a lot of myths, and show you the research on what works and what doesn't. So watch the masterclass if you haven't already. Now, let's summarize here. Don't wreck yourself. Don't let low back pain and sciatica absolutely wreck your body. And how are you going to do that? Well, number one, don't baby it. Don't do too little for too long, because your body's going to get really weak. And if you're really weak, then you're very easy to injure, right? Then even simple activities are going to injure you. So number two, don't do too much too fast, right? Don't just push through the pain unnecessarily, right? Don't push through unsafe pain. Really, what I'm saying here is you need to understand the difference between safe pain and unsafe pain, and you need to understand the difference between too little and too much. And this is the hardest thing to do, and because most people suck at moderation. So instead, we want to be like Goldilocks. We want to just find the amount of exercise that's just right today. And then tomorrow, whatever's just right might be a little different. And then the next day, it might be a little different. And we work our way one day at a time, eventually towards reclaiming the active life you love. So, and the last bit is, hey, I do free consultations. So if you want one, just watch the masterclass and then book a call. And I'm happy to help you out if you have low back pain and or sciatica. So if you want to, then the most important thing is that you fix it now. The most important thing is that you don't end up letting low back pain and sciatica absolutely wreck your body, because if it does, this leads to a really, really bad place. Low back pain is the #1 cause of disability in the world. It's more disabling than cancer. It's more disabling than heart disease. It's more expensive than cancer or heart disease. So you do not want this to happen, because ultimately, it can lead to a place where pain can cost you your job, right? Either taking time off of work, losing income, or actually not being able to work at all and burning that cash. So if you want to know how to make sure that pain does not cost you your job, watch the next video in this series. The video will appear on the screen, and I will see you in the next one.